you a doctor or nurse facing a pay cut? The COVID-19 pandemic is creating unprecedented financial hardships for many Americans, including the very healthcare workers fighting the disease on the front lines. For doctors, pay cuts can make a stressful time even more complicated. And further, it's not just doctors who are feeling the impact of tightening healthcare budgets. Nurse pay cuts in various parts of the country are also causing financial strain for many. If you're working in healthcare and are struggling to adjust to a reduced personal budget after a pay cut, here are some tips to help you through this challenging time. Tip number 1, know that frontline worker pay cuts are temporary. Student Loan Planners survey results shows about 22% of nurses, 29% of nurse practitioners, and 22% of physicians have experienced a drop in income since May 2020. Doctors, nurses, and other frontline workers experiencing pay cuts during the pandemic shouldn't fear that the reduced pay will be permanent for the rest of their careers. In the United States, hospitals determine their labor costs as a percentage of the revenue they bring in. As elective surgeries and other revenue-generating procedures resume, hospitals will again have to increase pay to remain competitive. Tip number 2, reduce your income-driven repayment payments. If your income decreases, don't forget that you can have your income-driven repayment, also known as IDR, reduced after the federal forbearance program is over on September 30th, 2020. Although your tax returns are typically used to determine your IDR payments, you have the right to request a change in payments anytime your income drops. You can easily recertify your IDR income. So when it comes to recertifying your income, make sure you are honest about your current situation. Don't misrepresent your income to make it appear like you're earning less than you actually are. You can request a change if your income is dropped for any reason, including a pay cut from an employer, if your spouse lost their job, or a decrease in earnings because of having to cut hours to stay home with children whose schools are closed. For more information about how to manage your nursing student loan debt or to contact myself, visit wealthness.com/nursing for more information. And as always, thanks for watching.